If you've got headaches and migraines and you've ever thought, how on earth is physio meant to help something that feels like it's happening in my brain? That's a fair question, and it's one we get almost every day. Because when you've got the nausea, the light sensitivity, the dizziness, the pounding pain, the brain fog, the need to go and lie in a dark room and shut the world out, it doesn't exactly feel like a physio problem, does it? And if you've already tried treatment before and it didn't help, or worse, it flared you up, I get why you'd be skeptical. I've seen it all treating this stuff for more than 15 years. That's why in this video, I want to show you a few things. Why your headaches and migraines may not be as random as they seem, how the neck can feed into the same system driving your symptoms, what signs tell us that physio may actually help, including if it's made you worse in the past, and how the right assessment can uncover the missing piece. G'day, it's Chris Fawcett here from the Headache and Pain Management Centre here in Annerley. Now, before we get started, a quick but very important note. If you're experiencing brand new severe headaches, a first ever migraine withdrawal, or any major change in your usual symptom pattern, please stop watching and go and see a doctor, go to emergency straight away, okay? But if you've been dealing with headaches and migraines for a while, it's been going on, it's fairly stable, but no one seems to be able to properly explain what's actually driving it, then this video is for you. Because today I want to answer one of the biggest questions we get asked. How can physiotherapy actually help headaches and migraines? And look, I get why this sounds a bit strange. When you're in the middle of a migraine, the nausea, the light sensitivity, the need to go and lie down in a dark room and shut the world out, physio is probably not the first thing that comes to mind. So let me clear something up first. When people hear physio for headaches, they usually land in one of two camps. Camp number one, I've already tried everything and it didn't fix it. It might have helped for a few days, but it always came back, or it made it worse. Camp number two, the scans are clear, I've been told there's nothing structurally wrong, so what is physio even going to find that no one else has? Now, both of these reactions make complete sense. And if either one sounds familiar, stay with me, because what I'm about to explain is probably the missing piece. Here's the thing, at the base of the brain, there's a region where signals from your upper neck, your face, your jaw, and your scalp all feed into the same spots. Now, if you think of it as a switchboard, that switchboard gets wound up, it gets sensitized, it starts misreading normal signals as dangerous, and the outcome is pain and worse. That's why a problem at the top of your neck can produce a full-blown migraine. The nausea, light sensitivity, the pounding, the need to lie in a dark room. And it's not because the migraines are just neck pain, the neck feeds directly into the system driving your symptoms. And here's why that matters for both camps. If the physio you previously saw was treating your neck, but not the right part of your neck in the right way, one of two things may have happened and both make sense. It either helped temporarily but never held, or it flared right up. And we hear both of these stories every day. And if your scans came back clear, well, that's actually not surprising at all. The issues with the joints at the top of the neck that we're most interested in, the ones that are most likely to be feeding into this system, they very often don't show up anything on imaging. They can only be found by someone who knows exactly what to test for and how to test for it. So if no one's done that just yet, that might be exactly why you're still stuck. One question that comes up a lot is, why do my headaches and migraines feel so different on different days? Are they all connected? Here's where it gets really interesting. A lot of people think headaches, migraines, tension headaches, cervicogenic headaches, cluster headaches, vestibular migraines, and facial pain are all totally separate things. And at times, people can be diagnosed with 5 different types of headache and migraine in the same person. Now, sometimes those labels are useful, but clinically, it's often not that neat. So one person might get a mild headache, another gets a migraine, another gets dizziness, another gets facial pain, another gets a more mixed presentation, all from a system that's being wound up in a similar place. That helps explain something a lot of patients find deeply confusing. Why the symptoms can change, why an attack might feel more hormonal, why one feels neck driven, why one feels more migraine-y, why another one feels like there's more pressure in the head, eye, face or jaw. And no, it's not necessarily because your body's random. It's often because the system is already sensitized and different things tip it over in different ways. That's a much more useful explanation than just saying, oh, it's just stress, it's hormones, or that's just migraines. And when people finally hear that, a lot of them feel like this huge exhale because suddenly it all makes sense. So what is physiotherapy actually looking for? Now, this is the part that most people are never actually told. When we assess someone with headaches or migraines, we're not just looking for a tight muscle and hoping for the best. What we're looking for are signs that the upper neck is feeding into the symptom pattern and whether there's something we can actually do about it. So what we want to know is what brings it on and what eases it. Whether it swaps sides, left to right. Whether there's neck pain with it, whether the pain is local, one-sided, behind the eye, across the forehead, into the jaw or face, or some mixed combination of all of those. Whether your scans are clear, whether there was a whiplash, a concussion or trauma before it all started. And critically, whether we can reproduce your familiar symptoms with specific pressure and then ease them by holding that pressure. Now that last one's really important, okay? One of the strongest clinical signs that the neck is involved is exactly that. We can bring on your symptoms and we can reduce them. Now that's not guessing, that's testing, that's clinical reasoning. That is us trying to answer one question. Is your neck actually part of this? Because if it is, that's a very good sign that treatment can help. What part of the neck are we actually talking about here? Now, it's usually the top three joints. Not the bottom of the neck, not the traps, not just posture, the top three, somewhere up here. Now, this area has a really strong relationship with head pain, migraine symptoms, and referred pain into the head and face. And importantly, a problem here won't show up on a scan. Now, because a lot of people have had MRIs, CTs, and specialist opinions, they've been told everything's normal and they walk away thinking, so what? Is this just in my head? No. It just means the scan didn't show the thing that needs to be tested clinically. Movement. Joints at the top of the neck that aren't moving properly won't show up in imaging. They can only be found by someone who knows exactly what to test for and how to test for it. That's also why a one-off crack or one-off massage can sometimes make things worse. If the neck hasn't been properly assessed first, treatment can go completely in the wrong direction. And I know what some of you might be thinking. Yeah, someone's looked at my neck and it made things worse. Here's what I want you to know about that. Are you ready? Previous treatment that flared you up is not a dead end. It's actually really useful information. Over the years, we've developed a way of assessing and treating that allows us to work carefully, even with people who are highly sensitive or have had bad experiences before. Nobody does it like we do here. I'm confident of that. Now, what's been tried previously, what helped, what didn't, what made things worse, that tells us a lot about how to approach things differently. There's not much we haven't seen, the good, the bad, and the ugly. We move carefully, we check in at every step, and if something's not sitting right, we back off and we go a different way. You're never just worked on, you're part of working it out. Now you may be thinking, what about triggers like hormones, stress, sleep, food, and screens? Now these matter, of course they matter. But here's the kicker, they may not be the whole story, and we've got a full video on them. What does physio actually do then? Well, more than people think. Yes, there can be a bit of a hands-on component, but that's only a part of it. Good physiotherapy for headaches and migraines is about all of these things. Working out firstly whether the upper neck is involved. Seeing whether symptoms can be reproduced or reduced with palpation or exercise. Identifying stiff joints, sensitive areas, weakness or poor control. Teaching you what's actually going on in plain English. Using the right kind of exercises and self-management tools. Knowing when to stay hands-on as a physio and when to stay hands-off. And coordinating with your GP, your neurologist or specialist team when needed. That's a very different model to, hey, come in, get a quick massage, crack your neck and hope for the best. Sometimes people are too sensitive for direct pushing on the joints early on. Sometimes the direction used previously was wrong. Sometimes the hands-on work helps, but strength and control are the missing pieces. Sometimes the explanation itself is the first bit of relief, because a lot of the fear that has come from not knowing what the pain means is overriding everything. When somebody finally understands what's driving their symptoms, something shifts. It doesn't fix it overnight, but it changes their relationship with it, and that can be the most important first step. Who is physiotherapy likely to help? Now, that's the question people really want answered, and the honest answer is not everyone, but a lot more people than you think. It's especially worth getting a proper assessment when you have headaches or migraines and your scans are clear. When you also have neck pain, shoulder blade pain, or stiffness. That your symptoms can swap sides, like left to right between or during attacks, or they've been building gradually over time. There was a whiplash, concussion, trauma, or a neck issue before it all got worse. When you've been avoiding triggers, avoiding wine, watching your sleep, cutting out certain foods, but you still feel like you're just chasing your tail. Or you've got a mixed pattern that no one's ever explained clearly and it's driving you crazy. And if everything serious has already been ruled out, in practice, most longer standing headache and migraine cases are worth assessing through the neck first lens. Now that does not mean physio is the whole answer every time. Sometimes it's the big or most important part. Sometimes it's half the picture, and sometimes it works alongside specialist or medical care. But knowing where physio fits or whether it's relevant for you specifically is one of the most useful things that we can do. Now, a really important caution. Now, I do want to be careful here. Not every headache should be assumed to be a simple neck issue from day one. And if you experience any of the following symptoms, brand new severe headaches, first ever migraine with aura, major changes in symptom pattern, or other concerning features, that should be checked first. Okay, that's really important. Good care is not about forcing every person onto the same explanation or the same plan. It's about knowing when the neck is likely relevant and when something else needs to be ruled out first. That is the biggest part of doing this properly. So let's bring all that together. We're not saying your headaches and migraines are just neck pain. What we're saying to you is that the upper neck can feed directly into the same sensitized system involved in headaches, migraines, dizziness, facial pains, and all of those mixed, shifting patterns that no one's able to explain clearly to you. That means a proper physio assessment can help figure out whether your neck is one of the drivers. Test it, measure it, and if it's involved, start doing something about it. Calming the system down, restoring movement, building strength, and giving you a plan that actually makes sense. Not just avoid your triggers and hope for the best. Good luck. And if you've had scans, labels, multiple practitioners, and years of advice that just hasn't added up, but nobody has ever properly assessed the role your neck might be playing, that might be exactly what's been missing. Now, if that sounds like you, here's what I'd suggest. Start with our $59 initial consultation. We'll listen properly, not a 5-minute rushed appointment. We'll assess thoroughly. We'll tell you honestly whether we think we can help and what that might look like. And if we're not the right fit, we'll do our best to point you in the right direction. Or if you want to have a quick conversation first, book in a free 10-minute call. No obligation, just a chance to ask your questions and to work out whether it's worth coming in. There's a link below for both options. I hope this has been really, really helpful. If you've got questions, drop them in the comments. I read every single one. Cheers and bye for now.